My right eyebrow and arch is different than my left side. Is it because of my right droopy eyelid? How can I fix both? My right eye is super droopy, and my eyebrow is also way out of place compared to the left side. I thought it was how I got my eyebrows done, so I let them grow. When I let them fully grow and did them, they are still way different, with the droopy side having a much higher placement. I tried doing research, but it seems I'm the only one with this issue. I don't even have my eyebrows done in the pictures, so just imagine how much different they look when they are done.
Thank you for your question. You're asking in the question with the photos you submitted that your right eyebrow arch is very different from your left side. And you're asking, is it because of the drooping of the right upper eyelid? And your follow-up question is about whether or not you can fix both. Well, I can certainly give you some guidance, and this is, of course, in the absence of a physical exam, but with the photos you submitted, which are certainly very good and very helpful, I can explain to you a little bit about how I approach this problem in my practice every day, and for someone like yourself. A little bit of background: I'm a board-certified cosmetic surgeon and a fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice for over 20 years in Manhattan and Long Island, and dealing with complex as well as cosmetic issues of the areas around the eyes is an area that I work a lot in. And so I think that your question has a lot of logic to it. And for example, before going there, I'm going to first talk about a little bit of terminology. The first term that I'm going to help you with is referring to the right upper eyelid. The right upper eyelid is lower compared to the left upper eyelid. And so that condition we refer to as ptosis. Ptosis means droop. And in the case of eyelid drooping, it's eyelid ptosis. Now, within the normal population, within just look at anybody around you, you can probably appreciate that it is within a normal range to have one eyelid slightly lower than the other eyelid. As long as it's within 1 to 2 millimeters, most people don't really recognize it, or it doesn't bother them. In your situation, you clearly are noticing it, and certainly there is a difference. Now, whether or not it's justifiable to do something about it, that's based on understanding the risks and benefits of performing a ptosis procedure. So, understanding that, when you talk about the arch of your brows, you're probably on the right track in a way, because in my practice, when people have something called acquired ptosis or age-related ptosis, as their eyelids droop more, they tend to raise their eyebrows. And it's an unconscious reflex. Basically, what they don't realize is as their eyelids are getting lower and lower, their brains are basically activating whatever the muscles they can to try to open up the eyes so they can see better. Very often people come with horizontal forehead lines, with that concerned about the lines. And I've seen many patients who went to let's say a dermatologist to treat the lines across the forehead, and not realizing that that was a compensatory mechanism for drooping eyelids. The doctor injected them with Botox, relaxed their forehead, and then they were upset because they got all this extra skin over their eyes. And that's a different topic altogether. I think that with the photos you submitted, your eyebrow asymmetry is probably more associated with just bone structure. The human face is not perfectly symmetric. There's one side that's always more prominent than the other, and therefore it can affect the shape and position of the eyebrows, and it's extremely common. So although these anatomic issues you have identified very well, they are not necessarily causally related. In other words, the eyebrow arch is not necessarily because of the eyelid droop. Again, this requires a physical examination. In a physical examination, I'd actually relax the eyebrow by putting my hand on the forehead and see how the eyelid position changes. There are a lot of things we do to evaluate eyelids and eyebrows that can't be done with just photos alone. So, that being said, I would recommend you meet with a qualified, experienced specialist, somebody who really understands eyelids and eyebrow position. Typically, this would be an oculoplastic or oculofacial plastic surgeon. Learn about your options. Figure out if it's worthwhile, if the eyelid droop is significant enough for you to pursue treatment. Briefly, when we perform ptosis surgery in our office, we do this under local anesthesia with light sedation. We have the person open and close their eyes during surgery. We sit them up during surgery. It's a very dynamic process. Now, that's something to be factored in because your goal is to achieve a certain level of symmetry, but with that comes a certain set of risks and benefits that you have to understand before you pursue this type of option. So I hope that was helpful. I wish you the best of luck. Thank you for your question.